In this video, we will learn about the symptoms, diagnosis, treatment, complications related to the treatment and recovery from inguinal hernia repair. A hernia represents a weakness in the abdominal wall through which the contents of the abdomen protrude outwards in an abnormal fashion. Inguinal hernia is the commonest hernia in the groin, specifically in men, which accounts for by far the great majority of hernias. It occurs at the site where in men the spermatic cord traverses the abdomen and comes out to the surface in its travel down to the scrotum. It is at this site that a weakness may develop. It can also be congenital, that is a birth defect. In this cartoon we can see the spermatic cord, and right next to it is the sac or the hernia coming in from the abdomen. An inguinal hernia typically appears as a lump above the ligament, the inguinal ligament, as seen over here. In this cartoon you can see a loop of bowel that traverses outside of the abdomen through the defect over here and coming to the surface. This accounts for over 90% of the groin hernias in men and less so in women. In the beginning it just appears as an asymptomatic lump that has no symptoms at all. As it progresses, it may cause a dragging sensation in the groin as well as a burning type pain and finally frank pain. These symptoms are a lot worse after strenuous activity, which increases the pressure within the abdomen, thus causing the hernia to push out. As the hernia progresses, it may become incarcerated. It means that no longer goes back into the abdomen. If associated with pain, this is a dangerous symptom and should indicate the need for referral for surgery. And finally, strangulation, which refers to loss of blood supply at the exit point called the neck of the hernia, which traps the contents of the hernia, such as the bowel in this case, thus losing the blood supply and becoming gangrenous and causing a life-threatening complication. Any hernia that becomes acutely painful and would not go back into the abdomen, the patients ought to present themselves to the nearest hospital. It is important to point out that there are many causes of pain in the groin, such as from arthritis of the hip or strain within the groin from muscular activity, as well as several others. The presence of a hernia does not necessarily mean that that is the cause of the symptoms, and the doctors looking after these patients ought to differentiate this carefully. The diagnosis of inguinal hernia is usually with clinical examination, the appearance of a lump that reduces back into the abdomen, and when a hand is placed on it and the patient coughs, a thrill is felt at the site of the hernia, indicating a defect. When the diagnosis is not clear, then an ultrasound scan of the groin is performed to clinch the diagnosis. When other causes are suspected of groin pain, then an MRI scan may be invaluable in differentiating other likely contributors to the symptoms of the patient, and less commonly the CT scan. The definitive treatment of the hernia is to have an operation to repair the hernia. However, this is dependent on several factors. It is okay to observe men with inguinal hernia who do not have any symptoms. Equally, patients who are unfit to have any kind of an operation will not be candidates. And in that case, it's best to palliate the symptoms by avoiding activity that increases the pressure within the abdomen. And in some instances, some patients may find it useful to wear devices on the groin that put pressure at the site of the hernia and stops it from protruding out when they are up and about. These devices are called a truss. In women and men with symptoms, surgery is the best option. With an acutely painful hernia, or to present themselves immediately to the nearest hospital to consider emergency surgery. The surgery for inguinal hernia can be through the open route, which is from the front, without getting into the abdomen. In this instance, the great majority of the patients, a mesh is used to reinforce the defect and stop the hernia from occurring again. This can also be performed through the robotic or laparoscopic route as seen over here. In the open operation, the sac of the hernia, or the hernia itself, is pushed back into the abdomen. The spermatic cord in men is elevated, and then a mesh is placed to reinforce the defect, and then the wound is closed with stitches. It has now been proved through medical research that use of the mesh is safe and not associated with undue complications. However, an open operation may also be performed without a mesh called a tissue repair. The keyhole laparoscopic or robotic approach shows a view such as this. A hernial defect is seen over here with an instrument going through it. The hernial sac is reduced back into the abdomen, and then a space is created to insert a mesh. The lining of the abdomen is then used to cover the mesh to stop its contact with the bowel. A laparoscopic or robotic repair is always with a mesh. The great majority of one-sided hernias are repaired through the open route. Those with bilateral hernias, that is hernias on both sides, are best approached through the keyhole or laparoscopic route. That the laparoscopic route, especially for the bilateral hernias, is associated with less pain and a quicker recovery. For one-sided hernia repair, there are some advantages of the open approach, which is the commonest procedure performed worldwide for one-sided hernias. In this cartoon drawing, we can see a bowel protruding out, which is gently pushed back by gentle traction using the hand or the fingers and back into the abdomen. This may relieve symptoms for patients presenting as an emergency who do not undergo surgery. However, if this fails, then surgery ought to be carried out urgently for those suspected of strangulation. The complications of hernia repair, be it open or laparoscopic, include but is not limited to bruising at the site of the operation or in the groin, bleeding externally or, in case of laparoscopic, inside the abdomen, infection, which thankfully is exceedingly rare and tends to be on the surface. If the mesh is infected, then that needs to be removed, which means a second operation. A recurrence of a hernia with the use of the mesh, this has now significantly been reduced to less than 5%. In men, there's a risk of urinary retention, which normally settles over time. An area of the skin may develop numbness if one of the sensory nerves to the skin is damaged, either temporarily or permanently. With time, however, this area of numbness reduces in size. In approximately 10% of the cases, there may be chronic ache, which rarely can be quite disabling after the hernia operation. This occurs in around 10% of the cases. In the great majority of the patients, the achiness associated with hernia repair settles over a 6-month period. In patients who undergo operations for recurrent hernias or who have complex hernias, there is a risk of damage to the blood supply to the testicle, thus causing inflammation of the testes after the operation and significant pain, and finally resulting in atrophy of the testes. In other patients, there could be just pain and discomfort associated with the scrotum, which is relieved by using support garment called the jock straps. Injury to internal organs or to a major blood vessel is exceedingly rare. However, it is a rare risk, slightly higher in patients who undergo the laparoscopic or robotic repair rather than those who have a surface repair. The great majority of the hernia repairs are performed as a day case procedures. This means the patients can go home the same day. They have to meet certain discharge criteria, which means being fully awake, self-caring, and able to eat and drink, as well as having voided urine. The wound is inspected for undue bleeding or complications, and if all is good, then they are discharged home with medication, specifically pain medication, which they are advised to take continuously at least for 3 days, after which they may take it as required. Other symptoms to look out for and prevent is constipation. Laxatives may be used, as well as altering the diet appropriately. There are no specific do's and don'ts. They are encouraged to move around and go up and down stairs. Lying down or sitting for prolonged periods is not advisable. Strenuous activity is to be avoided, including contact sports or heavy lifting, weight training, etc. for 3 to 4 week period. Return to work, that is a desk job, is achievable, and this may vary from patient to patient, but the great majority will go back to work within a week to 10 days. Dangerous symptoms to look out for are undue pain, bruising, which is extending or bleeding, pain away from the site of the hernia, new symptoms such as abdominal pain and vomiting, feeling of lightheadedness or pallor. Any of these symptoms appearing, including discharge from the wound or temperature, patients ought to report this to their healthcare provider immediately. This completes this brief presentation on inguinal hernia. Please do like and subscribe. If you have any comments, please do share.